I can totally understand that if you're a man, having issues such as urine incontinence, it can be a problem, but also you are really hesitated to visit a pelvic floor physiotherapist. But there is a solution for you now, and that's why I'm here to talk about that. Welcome again to my channel. My name is Krisa Vafiadi. I'm a physiotherapist, and I'm going to talk about incontinence and management of urine incontinence in men. I would like to start by advising that you shouldn't be biased with having urine incontinence, and that you should get the help that you need and the help that you deserve, okay? Because being a man and having urine incontinence can influence a lot your quality of life, your sexual life, which is really important. And also, if you're doing a sport, for example, or an activity, it can even influence that. And instead of wearing pads for the rest of your life, you can actually do something and be proactive, which what it is to visit a pelvic floor physiotherapist that we can advise you on what exercises you should do and what treatment you should get. Also, what are the reasons, or what can be the reasons for a man to have urine incontinence is, first of all, having a prostatectomy. So after prostate cancer, that can be a result, urine incontinence, or also inflammation on the prostate. Also, it can be an older injury on your back or an injury on your pelvis that it can result in urine incontinence as well. Or age, okay? Getting older can actually decrease the muscle strength, not only on your rest of your body, but also on your pelvic floor muscles. And what you can do, yes, you can do exercises, you can change some of your habits of your daily activities, but all of those things, you need to get the advice of a pelvic floor physiotherapist and the assessment. So what a pelvic floor physiotherapist can do? Well, they can advise you on exercises or daily activities, on doing some treatment for you. And that can result in decreasing the symptoms, but also by decreasing the symptoms, you can get back your life, your sexual life, your sports, your activities, and you can decrease the times that you're wearing a pad, or you can even get rid of the pads, depending on the severity of your symptoms. So yes, you need to be checked from a urologist. You need to have a urine flow chart from your urologist first, and then you need to visit a pelvic floor physiotherapist. What does the pelvic floor treatment include? Well, first of all, we get the history, the subjective history. We explain, we educate you about where is the pelvic floor muscles, what are their functions, how to engage and how to relax the pelvic floor muscles. And then we go through some exercises to relax the outer layer of the pelvic floor muscles. And at the end, we continue with the assessment, which we do the assessment of your pelvic floor muscles to see how strong or how weak are the pelvic floor muscles. When we do the assessment, it's really important to understand that it's really, really mandatory for us to do the assessment, because through the assessment we can see how strong you are or how weak you are, or are you weak and also you're having an increased muscle tone or a spasm. Should we relax the muscles first and then increase the strength? How many repetitions of the exercise you should do, what type of the exercise you should do. So as you can see, doing the assessment and the treatment is really, really important, and you shouldn't be a bias. Is not a painful assessment or a painful treatment or something that you will not feel convenient with. You may not feel convenient a little bit at the beginning, but with the trust of your physiotherapist, there will be no issues at all. So I hope that you enjoyed our videos. Please drop us comments. If you have any questions, we are here to answer all of your questions. And also that help us to get better and also to have more ideas for other videos that you may enjoy. If you liked our video, please press like and subscribe to our channel for more.